Dear colleagues, I would like to present my 9th-month progress report on my PhD topic, which is cervical disease and their connection with health and clinical factors. So I am a resident doctor at the Semmelweis University in the Department of Obstetrics and Gynecology. My vision is that primary HPV detection-based cervical cancer screening will be implemented in Hungary in the next 5 years in above 30 years age group. And my mission is that to change the Hungarian guidelines on cervical cancer screening and treatment. So I have two specific goals to achieve it. Let's move on with the first, which is trichomonas vaginalis infection is associated with increased risk for cervical carcinogenesis. So this is the current state of our manuscripts. So now the article draft is finished and we will send it to internal review shortly, and we intend to publish in the American Journal of Obstetrics and Gynecology. So I would like to give you some background of my topic. Lifetime prevalence of HPV is around 80%, so it is necessary but not sufficient for the development of cervical cancer. Other risk factors are needed, and the trichomonas vaginalis infection causes inflammation and decreases protective barriers of the vagina and the cervix. Inflammation of the cervix might cause persistent HPV infection and the progress in cervical carcinogenesis. Our aim is to assess the effect of trichomonas infection on increased risk for cervical carcinogenesis. Our clinical question is that does trichomonas vaginalis infection increases the risk for cervical carcinogenesis? And our population are sexually active women. The exposure is TV infection. The comparator is the absence of trichomonas infection, and our outcome are HPV status as well as cytological and histological findings. We did our systematic search in 2021, October the 10th, and this is the flowchart of our selection. After all, we found 29 eligible studies. Now you can see the results of our manuscript. This is a feature of a forest plot of studies in trichomonas vaginalis and in connection with HPV. And we can say that women who were TV infected had an elevated risk for the diagnosis of HPV. And the after-all effect you can see here, it's 1.74. Also, we experienced quite high heterogeneity, and the subgroup analysis was based on the detection method of trichomonas vaginalis. Now you will see cytological and histological findings. This is the ASCUS type, and once again, women who were diagnosed with trichomonas vaginalis had an increased risk for the ASCUS diagnosis, and you can see the odds ratio right here, and here we experience the moderate heterogeneity. This is a truly precancerous state of the cervix, and we can say that women who were TV infected had an elevated risk for the diagnosis of high-grade squamous intraepithelial lesion. And here we can see that women who were diagnosed with trichomonas had an increased risk for cervical cancer. So this forest plot shows the trichomonas and cervical cancer connection. So the strength of this meta-analysis, this is the first one that investigated trichomonas vaginalis and HPV infection and different cervical lesions. We had a quite huge sample size, nearly 500,000 women. It's globally representative articles from all around the world. Of course, we have some issues to report. These are mostly cross-sectional studies, and we didn't have enough control on the confounding factors. And when it comes to cervical cancer, it's very important because it has many risk factors. And in some cases, we experience high heterogeneity. Our conclusion is that detection of HPV infection and cervical intraepithelial neoplasia is increased in the trichomonas vaginalis infected population. And in the subgroup analysis, there were big differences between the odds ratios, and the highest odds ratios was with the detection of PCR and with stain. So the implication is for practice. In the Western world, cervical cancer screening is mostly based on HPV. So when we detect it's HPV-based detection cervical screening. So when we detect an HPV, it is advisory to screen and treat for trichomonas vaginalis also, because there is a possible contribution to cervical carcinogenesis. And the implication for research that longitudinal studies are needed, especially examining whether the treatment of trichomonas vaginalis reduces the risk of cervical cancer. And if we move on with my second topic, this is the effect of topical imiquimod treatment on reducing cervical neoplasia. Once again, to give you some background, in case of cervical high seal, guidelines recommend surgical therapy. Around 90 cases, HPV is responsible for this lesion, but surgery doesn't treat the infection. And topical imiquimod is an immune response modifier and approved for genital warts and basal cell cancer and actinic keratosis in the field of dermatology and dermatologic oncology. Imiquimod fastens HPV clearance by 60% in one study. And our aim is to assess the efficacy and safety of topical imiquimod therapy on reducing cervical intraepithelial neoplasia. Our question is, what is the response rate to topical imiquimod treatment in cervical intraepithelial neoplasia? We would do a co-pop framework, so we would see the response rate and adverse events. The treatment would be topical imiquimod, and the population would be women with cervical intraepithelial neoplasia. And also we do the PICO framework. Our hypothesis is that topical imiquimod therapy is effective on reducing cervical intraepithelial neoplasia. We did our preliminary research, and we will do the flowchart of selection shortly. So this is my two specific goals to sum up my PhD research. And thank you very much for your kind attention. If you think you are too small to make a difference, try sleeping with a mosquito.
Congratulations to your brilliant work. I have one question with the first topic.
Yes.
On the first forest plot, we saw that the HPV infection and the trichomonas infection, the connection between them. But on the other plots, there is the connection between trichomonas infection and different cervical lesions.
Yes.
Do we know any of these patients who were involved about the HPV status?
Yeah, it's a very relevant question. Unfortunately, I mentioned in the limitation that we have very little control of the confounding, and basically that's what I meant, because in some cases we knew the HPV status, but mostly it was unknown. I mean, sometimes it was declared that woman had a TV status and also an HPV status, but not exactly known that which women had also TV infection and also HPV. So your response to your question is that unfortunately no.
I'm just curious regarding your second project, Balázs, whether if you give this topical imiquimod,
yes,
then I mean the first choice would be surgery, yes?
Yes.
But if you start to give any kind of medication actually for women with already a kind of neoplasia, then how safe is it? I mean, of course, you expect that actually it will have the effect and decrease or heal actually the neoplasia, or do you have to control it after a while? And when can you be sure that actually it's the treatment was effective, and you don't have to do anything else with that?
Thank you. It's also a very relevant question. Well, usually in the studies, first we have to state that imiquimod is not it's an off-label use for cervical intraepithelial neoplasia. And in studies where they applied imiquimod, they applied for like 12 or 16 weeks, and after like 4 weeks, so after like 4 or 5 months, they did a punch biopsy from the cervix, and they checked if the lesion progressed or regressed. If it progressed, they did a conization. They removed the whole cervical area. And if regressed, they of course did a control at like in 6 months. And it's once again, it wasn't cytology, it was always histology, because it's way more sensitive for detection of cervical intraepithelial neoplasia. So yeah, they had a.
Okay, thank you very much. I just realized that also in your PICO you have that in addition to a standard of care.
Yes.
So
yeah,
actually,
the standard of care was it's conization, because mostly these women were in the state of a pre-cancer state, meaning cervical intraepithelial neoplasia 2 or 3, and they did the conization to the standard care.
Okay,
mostly.
thank you.
If I could have one question going back to the first question. So are there studies where we know the HPV status and the TV status, and some studies where we don't, or we do not know the HPV status at all?
Actually, we do not know. There is one study that it was the donors and their collaborators. They were the ones who did that. They checked also the HPV status and the trichomonas status. And actually, we know that in their study, every woman in high SEAL who had trichomonas also had HPV, but not in the ascus group. So they hypothesized that maybe trichomonas vaginalis can truly cause ascus.
It can.
Yeah, it can. Yeah, sure. Yeah, it's not hypothetical, but I mean they proved that so that it can. Yes.
Thank you very much.